to the webinar, Customer Analytics. If you're joining us and you're having trouble with your audio, know that you can dial in from a telephone as well as using your computer's audio. Here with me, I have Robert Blundo, Director of Technical Operations and Analytics from Access Health Connecticut, and I am going to have him take it away. As always, I am Kim Hines, your Outreach Coordinator.
Thanks, Kim. So this is Rob Blundo at Access Health Connecticut. I'm the Director of Technical Operations and Analytics. So we do a lot of work here within the organization on a variety,
I haven't looked for it.
On a variety of fronts, one of which is the analytics.
But do you want me to buy it if I find it?
They want everyone to mute their phones, and I'm looking at Kim. Is there a way that we can mute
I'm
all
muting
lines as we
people.
present?
It's supposed to be automatically muted, but sometimes it...
Okay. So we do a variety of things here in the organization, but one of them is the analytics and the reportings across the organization. So with that said, one of the things we wanted to do for today's presentation is to share some of the findings from the last open period for 2017 and go over some of the emerging trends and some of the successes and opportunities and challenges that we had as well. So with that said, in the past, this update traditionally was provided as a presentation to our board of directors. However, as our organization matures, so does the reporting and the analytics that we produce. So this year, we've changed it up a little bit. This year, what we've done is we've produced a comprehensive report that we put out on our website. It's available to the community, and essentially what it does is it summarizes the latest open enrollment figures, but it also captures a variety of analytics across the Access Health customer base, the products that we offer, and in addition to that, we've captured a lot of the observations that occurred from a year-over-year perspective across open enrollments. The goal being that that comprehensive report that we put out there can serve as an annual pulse check and a reference document for the partners that we have out in the community. So as we look at slide 3, I've got some good news. For the sake of time and brevity, I won't be presenting that full report that's on the website. However, I will be presenting an executive summary of that report in the next 20 minutes or so for this presentation. And trying to keep it brief, I'll be providing a variety of high-level stats across all the 6 topics. Before I get there, though, the report that we do have on our website is about 40 pages worth of content. It's been all updated through February 1st, 2017. And it covers about 6 overarching topics intended to help Access Health and its constituents better understand our customers and our business offerings so that we can continue to improve service in the state. Those topics include a year-over-year comparison of open enrollments, a current snapshot of our marketplace composition, a refreshed profile of our customer base, our open enrollment retention and acquisition results, the plan selections and customer preferences that have occurred over the last open enrollment period, and a pricing analysis to give some financial insights from both a customer and a business perspective. We look at slide 4. What you'll see here is essentially the full contents from that report, but more importantly, the location of that report on the Access Health website. So anyone that's on the line, if you're looking for that report, it's out there on the Access Health agency site. And if you follow the URL on the bottom left here, you'll find that full-blown report under the Board of Directors meeting February 16th. So let's just dive right in. What we'll do is we'll start off with just a yearly comparison of the last 4 open enrollments. So on slide 6, what you'll see is each open enrollment period for the past 3 years. Each one of those periods has essentially carried a unique set of challenges. Those challenges included having our first open enrollment ever, conducting renewals for the first time, distributing tax information within an open enrollment period for the first time, and then lastly, just in general, just kind of dealing with the dynamic environment that we operate with in an open enrollment type period with operating exchange business. However, I must say that this year's open enrollment period brought about a variety of challenges that we hadn't seen in prior years. The decommissioning of 2 carriers is one of them. Changes to the way we support our brokers is another one. We had swings in premium pricing. And in addition to that, we had an election that fell in the middle of an open enrollment period that added to additional confusion for our customers and the actual ACA. So each one of these presented a unique challenge for acquiring and retaining customers during this open enrollment period, as well as it served as a catalyst that we had to react to in a very short amount of time. A lot of these things just started happening in the fall or later. So in summary, what you'll see is we closed out the open enrollment period with a customer base that's about 4% lower than the prior open enrollment period. We had a higher proportion of the population being unsubsidized. We saw a slight uptick in the age mix of our population. We saw a substantial increase in the Connecticut market share within that population. And additionally, we saw a decrease in the percentage of the population that was assisted by brokers, as you might expect. Despite all the challenges discussed, we did continue to see a sustained demand for the products we offer and the continued progress in getting the state covered and healthy. Of note, our net enrollment increased 14,137 customers. We retained over 75,000 enrollees from 2016 plans and successfully renewed them into 2017 plans. We acquired over 35,000 customers into new QHP policies over the course of the open enrollment period, of which 13.7 thousand were brand new accounts that we hadn't seen prior to the open enrollment period. And lastly, we helped 77,000 Medicaid enrollees complete their applications and their eligibility determinations over the course of that open enrollment period. So at its conclusion, we did see a slight uptick in the percentage of the population that does not receive premium assistance. And additionally, we saw both remaining carriers, their market share, their total customer base increase as well. So just a couple of recaps of what we've seen. So on slide 7, what we'll see is a very brief summary. I'm sorry, Kim, can you go to slide 9?
Yeah, sure.
So on slide 9, we'll see a very brief summary of the market in 2017, which will serve as a reminder for a lot of the folks that are probably on the call, but I do think it's important to just take a pulse check of what our total population looks like in 2017. From a financial assistance perspective, we see over 3/4 of the customer base is eligible to receive premium assistance or financial help with their premiums. Regarding health plan coverage, in terms of the carrier competition, Connecticut now accounts for 3/4 of the enrollment, while Anthem accounts for the remainder. And 10% of all QHP households are mixed households, meaning someone with QHP coverage has an individual in their household that is in a Husky program. Traditionally, it's a dependent. Regarding coverage deadlines, a large majority of the population enrolled or renewed prior to the December 15th deadline, meaning their coverage started on January 1st. So that's a good sign. And then lastly, regarding the broker assistance, we found that about 25% of the new enrollments received broker assistance, of which nearly 1/4 of them were AHCT brokers that were housed in the call center or the storefronts. On slide 10, we'll start diving into some of the QHP customer profiles and the analysis for this year. So as we dive into this, I think it's worthwhile to note the diversity of the customer base that we serve. Because we offer a product that's universally needed and we offer premium assistance to make that product affordable across a variety of income thresholds, we have customers that are both extremely diverse and the customer base that may have different factors and incentives when deciding whether to purchase from us. So given this diversity, I think it's important to break out the enrollees by those that are receiving an advanced premium tax credit reduction, those that are receiving just an advanced premium tax credit only, and those that are non-subsidized, because they are very different. In doing so, we'll see a variety of differences across the 3 segments. A few examples are the non-subsidized tend to be younger and have more lives in their household for QHP coverage. While on the other side of the spectrum, the APTC and CSR customers tend to have smaller QHP households. This could be potentially because they are more likely to have a dependent who is eligible for a Husky program and is enrolled in a Husky program, not a QHP program. They also have a lower retention rate, which again could be related to the fact that these individuals are more likely usually to transition out of a Husky program and into a heavily subsidized QHP program or vice versa. In terms of the population which receives APTC, we see that they experience the longest continued coverage without a gap. So about 43% of this population has retained coverage since 2015. So they've been customers for over 2 years in a row. So a good sign there from a retention perspective. As we flip over to slide 12, what we'll see is an additional breakout by financial assistance levels. We summarize some of the report's customer profile observations for 2017, which may be similar to some of the prior updates we've given. I know we gave an update in terms of the analytics last year in the fall. However, I think it's worthwhile to recap this. From an age mix perspective, 1/4 of the customer base is the coveted young invincibles. That's the age band that's 18 to 34 years old. The largest customer age band we have is 55 to 64-year-olds, and they account for about 30% of the customer base. And then lastly, we have about 1.5% of our customers which are over the age of 65, of which 300 are over the age of 75 and older. It's an interesting topic there. I mean, it's important because as you look at this population, I think we live in a healthcare world where the top 5% of claimants account for 50% of the total claim cost. So that is a population that is a heavy utilizer, but it's also from a premium setting perspective, it's just an interesting facet I think it's worth breaking out. From a customer geography perspective, our largest pockets of customers continue to reside in urban areas, with Fairfield County accounting for nearly a third of the total enrollment, and Stamford, Norwich, and Bridgeport being the top 3 cities in which we see our customers living in. Regarding income, 20% of our customers fall into the 151% to 200% FPL band, which is our largest FPL band. And just to give everyone an idea of what that actually means, that's about $23,500 in annual income for a single household. That income level allows the majority of these customers to receive or qualify for an APTC and a CSR at an 87% actuarial value level. And then speaking of APTC, we find over 10% of the customer base is declining to be determined eligible for Husky or an advanced premium tax credit. So this is the first question it's one of the first questions that appear in our application process. It's worded fairly simply. I think it's something, the verbiage on it is something to the effect of, would you like to qualify for premium assistance or coverage assistance? However, we do find that about 1 in 10 customers are selecting no on that. So I think the best case scenario is that these individuals know they're over the income threshold and they wouldn't like to go through the additional questions that are needed for that. However, I think worst case scenario is if someone doesn't understand that question, they select no, and the impact to them could be substantial. So I think it is worthwhile to note that. I mean, one of the things we'll be doing is as we start to think about web redesigns and we constantly are upkeeping our site, one of the things we'll do is we'll pay particular attention to that site, and maybe we can beef up some of that language to make sure folks are crystal clear on how the question actually is. Additionally, what we found is that 93% of our applicants are indicating that English is their preferred language. And of those applicants, we found about 33% have identified their race or ethnicity as something that is not associated with being white or non-white. So given the OE challenges we discussed earlier, we wanted to take a few minutes to focus in on the acquisition, the retention, and the churn that we've seen over the last 3 months. So on slide 14, what you'll see is the 3 segments we've tracked since the start of open enrollment for 2017. The first category is retention, which is defined as customers who enrolled in a 2016 policy prior to the start of open enrollment, and then they renewed into a 2017 plan, so they're essentially retained. Acquisition is defined as any enrollee who was enrolled in a 2017 policy who was not enrolled in a 2016 policy prior to the open enrollment period beginning. And then we've got attrition, which is defined as any customer who was enrolled in a 2016 policy prior to the open enrollment period beginning, and they didn't renew or enroll in a 2017 policy. So in terms of the open enrollment retention rates, we were able to retain about 78% of our population from a 2016 plan into a 2017 plan, which leaves us with about 32% acquisition for customers that are currently enrolled in the 2017 plan. On slide 15, we'll start to see some of that retention. So the retention this enrollment period was more challenging than any other enrollment period in the past 2 years. This is primarily because the customers eligible for auto renewals is substantially degraded by a few events that occurred. The first event is that there were 2 carriers that were no longer offering plans in 2017, which impacted about 11,000 enrollees who could have originally qualified for auto renewal, which means that they wouldn't have had to actively renew. In other words, they have to essentially come through our site and manually pick a plan. The second category is the discontinuance of 5 plans offered in 2016, and that resulted in about 12,000 enrollees not having an equivalent plan to automatically renew it. And then the third was the standard customer base who elects not to be automatically renewed. So these are folks who just don't select the option to automatically renew, and each year they would like to come in and shop and manually renew. So this year, only 63% of 2016 enrollees qualified for auto renewal, compared to 81% who qualified the prior year. If the first 2 segments were not issues, we suspect that this year's auto renewal would have been well above the 80% mark. And I think that's important to note because after assessing the retention rates across all these segments, we found that about 85% of the automatic renewal population was renewed versus only about 63% retention for the group that had to actively renew. So it's a material difference. I mean, from a customer perspective, it means they may need to spend quite a bit of time shopping for a plan and making another decision. And anytime you introduce a complex shopping experience to a customer, that increases the likelihood that they may not actually go through and purchase that product, or they may get stuck or miss a deadline, et cetera. So that automatic renewal rate is extremely important, something that I did want to just call out on here as we provide an update. My hopes are that next year we'll see it back up to 80%, and I think it'll ultimately serve the customers better as well as make the whole process smoother. So before we get too deep into slide 16, I think it's important just to recognize how unique the population is that we serve from an acquisition and a retention perspective. Traditional subscriber-based businesses have a change that occurs slowly over time, even in group health insurance markets. However, in the individual healthcare market, it's a little bit different, and even more so for the exchange. And that's primarily because a large portion of our population base is constantly gaining or losing coverage from alternate sources like employers or the Husky program. They're also being determined eligible for coverage on an annual basis, and oftentimes they're required to provide verification on an annual basis, all of which is usually triggered within a short amount of time, usually a 3-month period. So we see large changes in our customer base within a very short amount of time. So what I want to do is I just wanted to take note and pause and take inventory of our customer base at the end of this open enrollment period, because there's always the likelihood that it's going to be substantially different than the customer base that was there 3 months earlier. So similar to prior years, what we've done is we've broken out the population into that new acquisition group, which is essentially new accounts which were created prior to open enrollment. These are new accounts which are created during open enrollment. So in other words, these are brand new faces, people we've never seen before. They've never had accounts with us. We also break it out by reacquired customers. So these are customers who had an account through the Access Health website prior to the open enrollment period beginning. And we had retained customers who are customers that renewed their 2016 policy into a 2017 policy. So we're seeing some interesting high-level trends developing here. First is newly acquired customers are approximately 4 years younger on average than the retained customers. And we'll see some indicators of their income in the full-blown report. Regarding reacquired customers, there's nearly 1/3 of them have been transitioned from a Medicaid program. So again, this is some indications of some of the transitions we see between that population that turns in and out of coverage between Husky and QHP. And then regarding the retained customers, 81% of them have been customers for 1 straight year, while a little over half of them have been steady customers for over 2 years. So some interesting metrics there on the retention within the population. So at this point, many are probably wondering, what about the 21,000 customers who didn't renew? So slide 17 breaks out the reasons for this population not renewing, with about 1/4 of them having transitioned over to a Husky plan. About 3% are 64 years or older, which we attribute to them aging out into Medicare. 24% are actively canceling their coverage, and about 48% of them had coverage expired on a date that is related to essentially when coverage ends if someone doesn't take action to actually renew their plan, or they're not automatically renewed. So it's a good indication that these individuals just didn't take an action. Whether they wanted their coverage to end or not, we don't really know that level of detail, but essentially they didn't take enough action to actually renew into a plan for 2017. Regarding whether these leavers are deciding to go without health coverage, I think is an important question, because ultimately that's one of the biggest goals for Access Health. We want to make sure that as many people as possible are getting coverage within the state. What we did do is we included findings for this from a leaver study that we conducted in 2016, the fall of 2016. And what we found was about 50% of the non-subsidized leaders indicated getting coverage from an alternate source, while about 30% of the subsidized leavers report getting coverage through a different source other than Access Health's plans offered. As in past years, we begin to shift from open enrollment to special enrollment. What we do is we begin to shift our focus from traditionally in open enrollment, we have a focus on acquisition and retention of customers during that open enrollment span. We want to make sure we're keeping as many people covered as possible. Once the special enrollment period starts to come around, what we do is we kind of change that lens or that focus to individuals who still have activity to perform, or else they're going to lose coverage, or they may lose their premium assistance, et cetera. So one of the leading drivers of attrition in the off-season is customers failing to close out an open verification. At the end of this open enrollment period, we were measuring about 37% of the population still had verification items that needed to be submitted and reviewed. And then additionally, from a planning perspective, we see about 35% of those items are coming due the week of March 5th. So that's going to be a very busy week for us. That week obviously aligns 90 days after, or 95 days after the December 15th deadline. So a lot of volume, a lot of throughput that week as folks try to close out those remaining verifications to make sure that they're not being impacted by any kind of cancellations. On slide 19, we see another major contributor to attrition outside of the open enrollment period, which is the non-payment of premiums. So currently we're finding about 88% of our Anthem customers have made their first premium payment and effectuated their policy. So pretty good sign there. That's a pretty good effectuation rate. Unfortunately, we don't have that rate for the CVI population as we're working through some logistics right now with Connecticut on that one. On slide 21, we have a quick summary of plan selections and customer preferences. Can we go up to slide 21? Thank you, Kim. From a metal tier perspective, 64% of the total population has selected a plan that is in a silver tier. However, for the unsubsidized population, bronze plans are still the most popular. From a carrier perspective, 76% of customers who renewed and ended up switching carriers during the open enrollment period chose Connecticut, and then 79% of the newly acquired customers ended up picking a plan offered by Connecticut. So for those who are wondering why are so many folks picking Connecticut, I think it's important to note that our customers are extremely price conscious, and Connecticut's rates were generally lower than Anthem's in 2017. So I'd go out on a limb and say that's probably the largest contributor, or the largest factor towards Connecticut gaining so much market share this year. In terms of shopping trends, 34% of renewals selected a different plan from the 2016 plan. And of those, 67% selected a plan that was an equivalent metal tier, while 25% selected a metal tier, a plan that was in a lower metal tier. So essentially they took a plan that was less rich. Usually the trade-off there is a lower monthly premium cost, but higher exposure to out-of-pocket costs. And lastly, from a product selection perspective, over half of all the enrollees chose the standard silver plan offered by the carrier. And what we're also seeing is that about 16% of the population has selected a plan that's eligible for an HSA. All right, so we're rounding out to the last section here. So just a couple of high-level points on pricing. In the last section, what we want to do is just want to dive into some very high-level insights from a plan pricing perspective, from a consumer and a business perspective. So slide 13 shows the 2017 view of the average after APTC premiums by age band and financial assistance level. For example, you'll see for our largest age band, the 55 to 64 segment, you'll see that that accounts for nearly a third of the population, but their average APTC premium after APTC premium can range from $112 to $743, depending on their subsidy level. So a wild swing there. I mean, the one thing it does do is it gives us an idea as we're dealing with our customers what their out-of-pocket cost on a monthly basis could be depending on their age band as well as their income level and what they qualify for in terms of assistance. One other thing that I think is important to touch on is you know, we've all heard about the news about the premium increases and the impact it has on customers. What we did want to do is we wanted to try to measure that impact from a customer perspective. What we did here was essentially what we did was we took the average annual after APTC premium change for customers that were renewing between 2016 and 2017. There's a variety of variables that can cause premiums to fluctuate year over year, and that includes changes in rates, the changes in the customer rating factors. Every year, everyone's getting older, so that's always a factor that's going to change. The customer's plan selection, and then their eligibility for financial help. In an effort to control for one of the largest variables, what we did was we essentially tried to stratify this by the renewals based on their change in financial assistance level between 2016 and 2017. And after we control for that qualification of the financial assistance level, what we found was that customers who receive an APTC plus CSR in 2016 and they still receive that level of subsidy in 2017 had an average after APTC premium increase of $1.55. And that category accounts for about 55% of the population. Additionally, we found that the APTC only individuals experienced about roughly a $5.74 increase after APTC on a monthly basis. And the non-subsidized population experienced the largest increase, as you might expect. Their average increase was about $90.72. Also, as you might expect, the customers who were most impacted, or at least saw the biggest swings, were the customers who were moving in and out of financial assistance categories. So obviously customers who were losing an APTC, or they were shifting from really the most egregious scenario would be losing their APTC plus CSR to it becoming unsubsidized because of, let's say, an income increase. Those folks had experienced by far the largest increase, while folks who were gaining financial assistance saw the swing go the other way. That essentially their monthly premiums decreased from a monthly basis between 2016 and 2017. So some interesting findings there. I mean, I think what it does do is it helps us kind of understand from a customer perspective who's most at risk of, at least financial risk of premium swings, as well as the proportion of our population who's experiencing some of these changes from a pricing perspective. So I think at this point, what I'll do is I'll stop and I'll pause for questions. Yeah, let me pause here. Go ahead, Kim.
Okay, do you want to do your questions first, or do you want me to take care of the community partner information and then do questions?
Yeah, let's go ahead and do the community partner questions.
Okay. So as some of you might have heard before, we rely on our partners across the state to help us let their folks know that they need to get health coverage, help point their folks to us. And to that end, upcoming in March are our regional planning meetings, and these are really important. We would like our partners to come in a room and just talk about what went great during OE4, what could use improvement, and strategizing on the outreach all year round and what's coming up for next year. So you can see we have some plans throughout the state. This year, we're doing something a little bit different and having a separate meeting for CACs. We find that the CACs issues are a little bit different than those from just regular old community organizers. So I think it's going to be most helpful to have those issues dealt with in separate meetings. So there is one in Hartford on March 2nd for CACs and one in Stamford on March 28th. Other than that, we have Hartford March 7th, New Haven March 14th, Norwich March 21st, and again, Stamford March 30th. You all should have gotten an email on Saturday morning with links to RSVP. If not, just give me a shout, 860-327-5517, or email outreach@accesshealthct.com. And most exciting to me is that we now have the ability to take testimonials about how wonderful Access Health is online. So people, if they have any stories about how they were helped out by getting insurance through Access Health, please make sure that they go onto this website, learn.accesshealthct.com/share, and they can share their stories right on the website, no need for a middleman. These stories are going to be instrumental in trying to make sure that Access Health CT can offer this service going forward in years to come. This is just what the form looks like when you go to the Share Your Story and click through. Really, we just want last initial email and your story. It's pretty simple. And again, on our community partners page, as always, there's just all kinds of information from events, upcoming webinars. Our next community conference will be up there once that gets planned, and also a wealth of printable materials from immigration status and coverage, tax penalties, aging off your plan, COBRA information, just all sorts of things you can print out yourself and hand out to your folks. We do still have our community newsletter that goes out regularly, and it gives you all kinds of information on what Access Health is doing in the community, any news you need to know about legalities or anything else. So we encourage you to sign up for the community newsletter. And again, you can do that on the community page, learn.accesshealthct.com/community. And finally, also on this page are numbers to connect you with us. And it actually goes into specifics about who to call when, which is really handy because sometimes you have a question and you're not sure who to reach out to. So that is very helpful. And we also finally, please invite us to your events. We go to fairs, to rallies, to races, Wherever we can have a table, we really like to table and get information about Access Health directly to. Now, one last thing before I hand this back over to Rob for questions. I'm going to be sending out over the little chat box survey. If you could all please click through and just tell us how we're doing on these webinars and what you'd like to see more of. And again, just contact information on becoming a community partner. This webinar will be available online after it ends and we're able to put it up. So now let's go to questions. And there are a couple that have come in. Rob, are there any statistics on CAC assistance during open enrollment?
Yeah, we do. We do have stats on those. I don't have them at the tip of my fingertips. However, what we do have is any applicant who has associated with a CAC assister through the online application, we can pull those figures. We have seen them before, however, I don't have them ready. If that individual wants to reach out, I mean, I'm sure we can certainly tie that into either a future presentation or even share that with that individual as well.
Okay, why don't you send me an email at outreach@accesshealthct.org and I'll hook you up with Rob and get that information to you specifically. The next question is, I was told nobody above 65 years old should apply via Access Health. Why are 1.5% of the customers 65 years or older?
Yeah, that's actually a really good question. One of the reasons why is there's a portion of the population that's just not eligible for Medicare. If you're not a U.S. citizen or permanent legal resident who's lived in the U.S. for 5 years, you won't be eligible for Medicare. In addition, if you or your spouse haven't worked long enough to become eligible for Social Security, usually that's 40 credits of, or they call them working credits, which is about equivalent to about 10 years worth of work. Then at that point, you wouldn't qualify for Medicare either. So in that case, those individuals, their options are traditionally they can come through Access Health and purchase a plan, or they can go through a private carrier as well. That's primarily the 1.5% what their composition is.
Oh, that's really interesting. I did not know that. Another question that's come in. So how do enrollees benefit or use this information that we've gone over?
So the utilization by enrollees, I mean, I know that some enrollees are obviously just interested in the health law and some of the impact of some of the progress that's being made. However, the bigger impact on enrollees or the average enrollee is all of the analytics that you see here are essentially reports for the community to digest, but the underlying information is what goes into all of our outreach strategies. It goes into our reminders for our customers. It helps us craft our as effective as possible. It helps us make sure that the events that we have in our storefronts are going to be placed in the proper locations so that we can reach out to the most enrollees or have the biggest impact for our enrollees as possible. So there's a variety of reasons how we use this underlying information and this underlying capability to reach out to our customers. Unfortunately, the reports themselves, though, aside from appearing in the paper every once in a while and all that, most of our enrollees don't really have an interest in it.
Okay. I have one more question that came in via email, and then we can see if anybody else online has any questions. So when does this information get released that we just went over?
So the information that we just went over is essentially an executive summary of that full-blown report. So that full-blown report, again, is on the website, the Access Health Agency website. Additionally, whenever Access Health has a board meeting, all of those meetings are public meetings. And traditionally, 5, 6, 7 times a year, we'll go out and give an update on the enrollment stats, what we're seeing from trends, any kind of customer preferences or emerging trends, et cetera. So traditionally, we'll produce those reports for the board, and then they're made available publicly. So if anyone goes to the Access Health Agency website, they'll find all of those reports in one location.
Yep, and that's an argument to join our email list so that everyone can stay updated. Let's see, another question. What do you predict for OEP for 2018?
So we haven't yet forecasted what the enrollment's going to be for the end of 2018 enrollment. There's so many things right now that make forecasting difficult. You know, with everything that's going on, if you're an actuary, you're a statistician, you're trying to forecast the stuff, it's really a nightmare. But I mean, if we use past years as an example, I think what we're starting to see is we're starting to see a base established within the enrollment market. And traditionally, our forecasts are just showing between 110 and 120,000 in terms of enrollment. And based on that, we're starting to see the enrollment kind of solidify within that range. And it's been like that for the last 3 years.
All right, that's great. Are there any other questions from those of you who are online? Wait just a moment. Do you think the ACA will be intact for 2018?
Yeah, I mean, it's a great question. I hope so. I mean, right now the law is the way the law is, and the beauty of the way our government operates, as well as some of the pain points of it, is it moves very slowly. So right now the ACA is the law, and we're in operations. At the end of the day, what we did realize after this election is that we still do offer a product that a lot of folks want. So I have no reasons to believe that we won't be around for 2018. Last we've heard as well, every single carrier that's currently operating on the exchange is continuing to operate, is planning to operate in the 2018 exchange or the 2018 plan year. So I have no reason to believe that we won't be around for 2018.
Great. Well, I think that is all for the questions. Thank you guys so much for joining us this afternoon. We hope this was helpful. Thanks so much to Rob, who did a great job explaining all of this data. And look for this to be up on the community website in a day or two. If anyone missed it, you can access it that way. Thanks again.